being an issue, then we won't really need to use this. This is mostly just in case we have to poke you peripherally. We've got the sharps, the needles.
Okay.
These are your saline flushes.
Oh, good. Okay.
This is so this you'll essentially use 1, 2, 3, and then 4, 5 a day, essentially.
Because you just use one, and you put the whole thing in there, right?
Yes.
The whole amount. Okay.
Yep. So you'll have like this, essentially.
Yeah, I got you.
Yep. And then for the one that's twice a day, this cefepime, it'll look just like that.
Okay. They'll come in just a second. That's my son and his
Oh.
wife. We'll probably start over a little
Yeah.
bit. Okay. And then we'll all go in there where the pole is going to be.
Okay.
Come in.
Hi.
Come in, dear heart.
Or anything like that. After you flush with 10 mLs of saline. In order to administer this medication, all you do is literally hook it up. You undo this little thing right here, screw it on.
We're going to see that done in a little bit.
Yes. I'm going to go through it all. Unclamp it, and then this is pressurized in here. There's a little like core.
What hangs it to the pole?
Oh, you know what? That's why they didn't send you a pole. It's because you don't need a pole.
Oh, we don't need a pole.
No.
Just lay it on the table?
Yes, or stick it in his pocket or something like that.
Because it's pressurized.
Yes.
Oh,
that's good.
Exactly. Yeah.
That's good.
I don't know why it took me that long to connect the dots, but
Well, that doesn't keep him tied down to a certain location, so that's
Exactly.
You could walk around
Yeah.
if you wanted to.
exactly, you could put it in the walker or anything like that.
Okay.
So, yes, because it's pressurized, it doesn't have to hang.
Okay.
It's not gravity dependent or anything like that.
That's actually
Great.
There is a little core in here, which you can kind of see how this is like wrinkled right here.
Mm-hmm.
As this infuses the medication, it will get more and more wrinkled. And what it'll eventually look like is just the core. Yep, with just a bunch of wrinkled plastic on the outside.
Okay.
So,
That's how we'll know it's finished.
exactly. Yes. Yep. So this cefepime, this is the cefepime. This will be every 12 hours. This daptomycin is once a day.
24 hours.
Yep. So, in the evenings, you'll do both of them, and then in the morning, you'll just do the cefepime.
So he missed a cefepime. He missed that one this morning. He missed a dose.
That's what I'm assuming. I'm not entirely sure because
I know he did.
I know he did because he didn't have anything for
this
it.
morning.
See, they told me to call that pharmacy early so that they could get it here in time for an 11 o'clock dose. But they got here, but then the nursing, you all didn't have it.
Yeah, there was
order for it or something, and
not a whole lot of communicate. Yeah, because I didn't get a call until it was right before I called you, which I think was like 12:30. Was it 2?
I don't remember.
I think it was like 12:30 or so,
Something like
and
that,
yeah. So
well, anyway, he has missed one dose. I hope that doesn't matter.
Yeah,
We hope
you're on it for 8 weeks.
he's going to be on this for 8 weeks.
Yeah, October 7th is the stop date, is what this says.
My goodness.
That's a long time.
Yes.
So, they only have to give it to him twice a day then, right? It's 3 different, medication or 2 medications, and you do one of them twice a day. But it's not like we have to do one in the morning, one afternoon, and one evening. It's just morning and evening. And those can be given right back to back or at the same time?
Back to back. You
Okay.
want to do them.
Does it matter what order that goes in or anything?
Nope.
Okay. Just make sure.
Nope. The other thing in home health, and even in the hospital too, there's a little bit of flexibility technically. In home health, it is also not like an exact science. So if you do it an hour early or an hour later, that's kind of how you can adjust your start and end times.
Mm-hmm.
So,
Okay.
especially because, like for example, they gave it to him I think at midnight or something like that.
I don't know.
I think is what the nurse said was like
They gave it to him last
11:54
night?
or something like that.
Do you remember getting anything in your arm last night?
Last night?
Yeah.
Yes.
Yeah.
But not in my arm.
In that thing that's in
Your
your
PIC
arm.
line?
On the
Yeah.
PIC line. They were there every time I turned around.
Like literally.
So he's gotten some of that already then.
Yeah.
But not this morning, huh?
I don't know.
I think, which, like I said, this, I don't really have a way of looking on here, and there's no documentation as far as like what time they last gave it. But, like, for them to have done it at midnight, if we were to stick to their schedule, that would have meant that he's due for it at noon today, the cefepime, and then at midnight again, which delivering an antibiotic at midnight is
Not a good thing.
unreasonable. Yeah, especially being home
So
and
that's
for 8
why I
weeks.
think they probably said 11 this morning. Because if we could have gotten it back to 11, then
Yeah.
we could have done it at 10 tonight or something like that.
Yeah. So we'll do it. You know what?
Fudge just a little and get it back to the schedule week.
Yep. Exactly.
All right.
Which because we don't really have much of another option either. You know. So, like I said, it's unreasonable to grant it your home, but to do them at midnight, and it's
Particularly the other schedule is going to be hard because I'm not going to be here.
Yeah.
I'll leave here about 11:30 in the morning and don't get home until about 5.
Okay. So you could do like an 8 and 8 or something like that, possibly. Yeah.
Probably 9 in the morning.
Or 9 and 9
9
is
or 9:30 and then 9 at home at night. Okay.
yeah. So essentially, what you'll do is you'll just slowly work the
toward
times
that.
towards
Yes. Okay,
that.
we can do that.
It is not an exact science, and this is it's I don't want to say just cefepime, but it's just cefepime. It's not like we've got some antibiotics that are very, very specific, like vancomycin, for example, which have to be given at very specific times. Lots of lab work that correlates to the exact like concentration in your system. Cefepime is not really like that, so you know there's a little bit more leeway.
And she does not know what organism we're after. They may have gotten that from the hospital culture, but nobody.
The results haven't been finalized yet. It's still pending, is what it says, at least in here.
Mm-hmm.
Okay, so essentially, like today when we go to do this is essentially the order that it goes. So you always flush before the antibiotic, you always flush after the antibiotic. And because we're doing another one, you'll flush up before and after. So when you go to do the cefepime in the morning with the nurse, this is what it'll look like. You'll flush first, then you'll have your antibiotic, and then you'll flush again.
And then when we do it in the afternoon, it'll be the 3.
Yes, ma'am.
But flush
Yep.
before, after, middle, and after. Okay.
Exactly.
That is my next question: is how often will the nurses come?
So I've already got a nurse coming tomorrow morning.
What time?
That I don't know.
Not sure.
Yeah, because I don't know our schedules. I only know that because I called the scheduler personally and said he needs a visit in the morning with a nurse. Because I knew I would be here late. So our schedules technically are not finalized for another like 40 minutes. So,
Will she call me?
Yes,
Okay.
she will. However, the number listed as the main number
Okay.
is the 7172769.
Yeah, but you should give him my number.
Well, your number's listed in here, but it's not listed on the main page.
Well, put it on the main page because he sometimes doesn't answer the phone at all, and if he does, he can't hear it very well.
The 822.
105. Yes.
That's the best number.
Well, except when I'm in dialysis.
Yeah.
It's the one to call when I'm here. And I can even hear it over there, but I can't do anything about it. I'm over there hooked up to the machine.
Yeah.
So, but I could call home.
Let me put.
Call mine first, and if you don't get me, call him.
That's what I'm going to put a note in here.
Yeah. There comes the other son. I am blessed with family support.
That's very important to have.
It is.
Okay.
Cassie, you edit this a little bit, you can get a good flow.
Okay.
Yes, ma'am.
Yeah. Call away first, then call home.
Yeah, this 2769 or whatever.
2769. Yep.
Yeah, okay.
And honestly, we have a couple other people in here too. What is it?
That was for my PD that I was doing.
Oh, okay. Yeah.
I have some of it in there, but it's not exactly like that. But
Yeah,
It is
essentially what
Tegaderm.
this has is the Tegaderm. It's got Cetacera gloves. It's got Chloroprep, which chlorhexidine. to really disinfect the entry site. Because, like I said,
Well, that,
infection control is
yeah, very important. Yeah.
very, very important. Yeah.
But that's all everything in that bag is for the nurse,
Yep.
not for us.
Yep. Nope. You won't have to worry about this at all. It looks like this. Oh, okay.
It's a good thing because we can't keep up with it.
Yeah. So these are those green caps.
Oh, good.
So you
Actually, I'll
do
need
have.
those right away to put on when he finishes this.
Yep.
All right, now since we're doing 2 antibiotics, you don't change that in between them, do you?
No.
You
So
do the second one and then put those on.
Yep.
The cap seals it, so you wouldn't want to seal it before putting the next one in because you're doing the next one right away.
yeah. Well, and technically, in a worst case scenario, these don't actually. The only thing these really do is infection control. These are impregnated with, I think it's actually chlorhexidine as well, on the inside when you screw it on. So these usually drip a little
There's
bit when you.
I don't have it, but there's some little things they screw on the end of mine. Too.
Yes. So technically, the purple cap on the end of that, like that purple end piece, which let's see if they did not send you any more of those. The only thing they sent you, which is an extension tubing, which it may make it a little bit easier for you. So that way, this basically just literally extends it. I think, let's see,
The one
these are
that's
14
on the
inches.
antibiotic is pretty long, isn't it?
It is.
Yeah.
So really, this is just going to add an extra 14 inches on that you really don't need. The only time that this is super beneficial is when the patient themselves is doing it, because this allows it to be long enough for the patient to reach and pull.
I couldn't figure out.
Yeah.
Didn't make sense for me not to be able to get to it.
Yeah.
That's right.
So, and these have like a built-in clave right here. This little blue thing is the same as that purple thing. So it's got like an anti-reflux valve to where this is not going to drip out unless there is something that has been inserted and is like pressing them. Yep, exactly. So,
It's gonna happen by accident.
yeah, which I've never
Just
seen
close
it
that back
happen.
up, put it in the paper bag, and you'll have that all together
Yep,
there.
this, and the only other thing is this that's in here. This goes, because I don't think you have one of these on right now. No,
You don't have anything over here.
nope. Okay. This you cut in half, and what it does is it stretches, and it helps keep all of the tubes and lines kind of contained.
Wear it
Where
like a
they don't
sleeve.
Don't
Yep.
flap around.
Yep.
Yeah, I had a nurse come. I had a very bad wound on my arm, and while it had big scabs and bandages, she had a flexible dressing kind of like that. She wrapped
Yes,
it on the
it's
outside.
great for so many things.
Yeah.
Worst case, if this, which this is, you can get 2 out of this. And then when they call you and ask, what supplies do you need, and kind of, they'll also verify, make sure no new symptoms and stuff like that when the pharmacy calls you every week. You can always ask them for more of this too, more of like
What's
the
it called?
netting.
Just a flexible bandage.
Yeah, like a netting.
Netting.
Netting. Yep. Let's see. So,
Tube sock without the toe.
That's
essentially, which is what a lot of patients use, because not all pharmacies send this. So,
Okay.
yes, you can use that. The other thing that they sent you is alcohol swabs. So,
They're
what?
in little pouches, separate.
Yep.
Okay, I understand. That's what they use on me at the.
Yep. So this, like I said, infection control. You are going to want to use one of these to clean off the purple thing. We call it the hub. Scrub the hub. When you remove this green cap and before you go to flush it for the first time.
I understand that.
You want to scrub it for like 20 to 30 seconds at least. The actual friction.
Just like this, yeah.
Yep. The friction combined with the alcohol, but it's really the friction, like the actual scrubbing,
Yeah,
is
that's
what
what
will.
they do on this all the time, yeah.
Yes. So you'll want to do that before you.
Before the flush.
Yep, before the flush. Technically, when you are done with the flush, as long as nothing has touched that tip, when you go to disconnect it, you can hook this right up. You don't have to
Do that.
scrub the hub again. Some patients do. Some nurses teach it like that. As long as nothing touches, you want it to be, sterile essentially. Then, the only time you'll really want to scrub in between is, let's say that
You drop something on the floor and you pick it up and your hands are dirty.
Yeah, well, if depending on what you drop on the floor, you may just need to toss it. More than likely, you'll want to toss it, especially like these.
No, I didn't mean drop, but if you drop a piece of paper and you touch the floor.
Yeah. Well, and good hand washing is very, very important. If, let's say, you go to hook this up and you accidentally drop his line, so it touches the skin, then you want to just re-scrub it again. So, we'll use that. Let me see. And then I think this is just all your paperwork from the pharmacy.
Just stick it back in there, that's good.
Yep, everything else is,
What's the red box for?
so this is
Sharps.
a Sharps container.
Just
Dr. Gucci ordered labs. Usually he is okay with us drawing blood from the PICC line. So we don't have to stick him peripherally.
So we're probably not going to need that.
Yeah.
We won't.
You guys definitely won't.
No, not gonna do that.
Yeah.
You'd have to catch him first.
Yeah.
Fast on his feet. He doesn't look like he is, but he is.
Come at him with a needle.
Well, and that's kind of one of the things. We have one infectious disease doctor over on the east who will not let us draw from a PICC line no matter what. And so some of these patients have to get stuck
All the
a
time.
ton.
Hmm.
You know, some of these patients who are difficult sticks.
Yeah.
So,
Well,
and
but that's because they stick, when they do have to stick me, they bruise me all over.
yeah.
Why not put in a separate PICC line for that? Could they not do that?
They won't, because introducing another PICC line that's not 110% necessary is more risk for infection and DVTs and all that other stuff. Yeah. But his has the dual lumens, the double lumens.
Mhm.
So when you go to infuse, you can pretty much just use the blue one.
Don't ever use the red one. That's just for getting blood, right?
Usually, I'm gonna call when I call Dr. Gucci, I gotta call him back in the morning. I'm gonna ask to see if the medications are compatible also, because if they're compatible, then technically you could attach one to the red and one to the blue and
All
infuse
done
them
at once, yeah.
simultaneously. Yeah. So,
Well, if you decide to do that, let us know. Otherwise, I'm not going to do that.
yeah, don't do it.
Okay.
Usually, so, I mean, these are two pretty common medications. I don't know of anything off the top of my head that screams interaction, but until we confirm with Dr. Gucci and the pharmacy,
Yeah.
So let me get this.
You've met Dr. Gucci, have you?
I have not met him.
He's very nice.
Is he?
Yes, you like him.
Good.
So now tonight we're going to do 2, and in the morning he will do just the 1,
Yes.
the gas stuff.
Yep.
All right.
So 2 at night and 1 in the morning, regularly?
Yes.
And one of them is a repeat. It's just every 12 hours.
Right.
Yeah, well, they're about 12 hours apart.
Yeah.
So if they do it at 9 in the morning, it'd be 9 tomorrow night. It'd be better if they did it at 8:30 and 8:30, but he's not going to be awake at 8:30.
Yeah. And with that being said, you don't also necessarily have to be awake either, as long as.
Just go in there and
I mean,
plug you in.
I can tell you, I have done this many a times with patients literally still in bed, in their pajamas, and
Especially since it doesn't need a pole or anything like it.
Yeah.
Are the 2 different medications 2 different sizes? Are they identical? We don't want to get them confused.
It's written on
It's written on each one, but they are the same size. I
They're the
believe.
same size. Yeah, essentially, unless you actually look at the label, you wouldn't really.
Yeah.
In the fridge,
If he's
That's
doing
very
it to for himself, he cannot see.
they're in 2 separate bags. And
Yes.
I'll mark on the outside of the bag or put a piece of paper on the outside
Okay,
with it written really big.
Yeah. Yeah.
Because, he can't read that. He can
Yeah.
read
Because it is very, very tiny, this
Uh-huh.
thing. If you read the label, it'll tell you cefepime, and then it'll administer cefepime 2 grams every 12 hours, running each dose in over 30 minutes. You hook it up, they've essentially taken all the guesswork out of this, which is great. You don't have to sit there and try to mess with the drip factor and calculate how fast per second each drop is.
And
It's
I
a pain
asked
in
her
the butt.
this already. She said if it finishes, you don't have to be right there that second to disconnect it. It's not going to run air into his book.
Yeah, because this is a closed system.
Right.
So, you know.
So if I go ahead and go somewhere and eat breakfast and I come back 5 minutes late, that's all right. You can disconnect it then.
Yep.
That's not have to happen, but you know that's. type thing.
So let me see. So this daptomycin, is this the daptomycin? That's the cefepime. So this daptomycin, yep, once every 24 hours, run each dose over.
Okay,
30
well, let's
minutes.
move ourselves in there where he's going to do it.
Yep. Like I said, the very first thing that you'll want to do, and we're using this, oh, it's purple. It looked blue from back. It's the purple one compared to the red one.
Okay.
So this purple one, let me just look at this site.
If you'll step around this way a little bit, Jenna, then she's going to.
I can get it. Yep.
Okay. So this, you always want to leave this purple, like clear purple thing attached. Just remove the green part.
Yep.
Whoops.
We'll get it. Just toss it and I'll pick it up.
So, and then this, you've got the alcohol. This is where you want to scrub the hub. Because this is the friction. That is what's going to help get that nice and clean. Once this is clean, you don't want anything to touch it. Yep. Which this, it takes a little bit of skill, a little bit of practice, really. Perfect. So there's that. So this, like I said, when you go to take this off, you want to make sure nothing touches that, because that part, that's what goes in into here. So when you go to do this flush, you have to press and twist. It doesn't just screw on. You have to push. The pushing is what kind of presses it open.
All right.
And then should just flush really easily.
Nice and slow.
Yep, which it does. You might taste it or smell it in a minute. Especially if you push it real fast, you'll definitely know.
Interesting.
Yep. So now, okay.
So it's the blue one you said you use? Or
Well, it's purple.
blue purple.
But
Okay.
yes.
It's not the red one.
Yeah.
Red means stop.
Oh, technically, they are the same exact. They're lumens. They
Just
both
want to
go
stick with the
through.
same one. Yeah.
Yeah.
Okay.
But I'll clarify with Dr. Aguchi too.
Okay. Gotcha.
So now.
Perfect.
That's
You get to
okay.
use both.
So now, as far as this ball will literally just sit wherever. You can toss it in your pocket. This part comes off just like how the saline thing comes off. It literally just twists. So all you do is unscrew that, and then you'll want to untwist this. You push and screw. So now you're all hooked up. The only thing to get it running is to unclamp this.
Yeah.
And this, if you have to kind of hold it like this and
Spring the clamp. Yeah,
yep,
okay.
exactly. And then it will start going. And then that's that. So, whoops, no.
520.
520. Okay. So in about 30 minutes, you'll notice, and like 5 minutes, you'll notice this like plastic start
Begins to
getting
collapse
looser.
a little. Yeah.
Yep. So, all right. So that's that.
So if it's not getting looser, then
It means there's some kind of occlusion or something.
Right.
So now when this is finished, then you flush again.
Yep.
And put the next one on.
Yep.
If there's an inclusion, what happens?
I think that when that
Call
happens,
someone.
that
Yep.
I will do it.
We call someone.
You call
If
us.
there's an occlusion, if it's not flowing and you think you've got it hooked up, it's time to call someone.
Yeah. Oh yeah.
because that could be the PIC line. Well, I guess it wouldn't.
It could be.
They may talk you through something, but
Yeah.
not
Yeah.
enough time to start guessing.
Yeah, exactly. Worst case, you can call us. A lot of times we can troubleshoot over the phone. We'll have you,
this or
disconnect
that,
it,
yeah, right.
flush it. Sometimes, especially not right now because they just inserted it, but 4 or 5 weeks from now, it may get a little wonky, which I've seen them do from time to time. Sometimes you have to flush it and use a little bit of force. You have to kind of pump it like that with 2 mLs, and that kind of gets things moving. But worst case, if it's not flushing, you call us. If we can't figure it out, we'll send somebody out, that type of thing. So
How do you know that it's actually running once you hook it up?
She said after about 5 minutes, it'll start getting more wrinkly. Like you'll see that there's
Yeah,
some
so
missing. It won't be
so
a
it
full
takes-
hard.
There's no way to
Yeah.
know immediately.
no,
Right.
I sent
No,
no.
it's already. You can tell it's different already.
Yeah.
Can you fill it at all, Mr. Fred?
Fred, can you feel it going in?
No.
You don't feel any coldness or anything? Okay.
And I mentioned this to them too. You want to take it out like 30 minutes to an hour prior. Let it get warmed up to room temperature. If it's slightly cool, the main thing with the temperature is it's going to affect like the viscosity, how
How well it flows. Yeah.
exactly. Yeah.
Do what?
How well it flows,
Oh, yeah.
essentially. Yeah. I mean, granted, this is pressurized, so really, even it being kind of cold, not going to really do much because the pressure is going to kind of override that, but
Might freeze him.
yeah.
Toss it in the microwave and warm it up.
Well, you don't want to do that.
No.
No.
Just pick it up and squeeze it.
Yeah, you can kind of like hold it, in your hand or, that type of thing.
Squeeze it like a stress ball. Just
But yeah, but both of these are to room temperature. The only time that you will need this, so after this,
After the second one.
exactly, yep. After this, we're gonna flush you again. We'll hook up this. We'll flush you one last time, and then you'll get your green cap for the day. So, for until the
And do we
morning.
have enough caps to do that twice a day?
You should. You've got quite a few in here.
probably get more too.
Yes, and when they call you and they re-up your medications, let them know you need more green caps.
So a new cap every time.
Yes,
Every time you finish, yeah.
twice a day. So you've got, let's see, 1, 2, 3, 4, 5, 6, 7, 8, 9, like 10 days worth right here.
Okay.
And there's more in there,
the
yeah.
bag.
Oh, yeah, so look at
Okay,
that.
so it looks like we're fine there. Okay.
Yeah,
Good deal.
Fine for
2 days, yeah.
but they will oftentimes not send these if you don't specifically tell them. So just make sure you mention it to
The
them.
nurse at the hospital used the same cap he had just taken off.
She put the same one back on?
No,
did.
you wouldn't want to do that.
I think he did.
Oh, you may have. You don't, yeah, you don't
We don't do
really.
that.
It's not. It's not proper.
Especially being like in the home environment, I'm with the hospital.
Always more infection
And I
risk.
might have misseen that. I wasn't really paying that close attention. I
Yeah.
certainly didn't call him on it.
Yeah, no.
You say, wait a minute.
Well, they do a lot of things differently in the hospital than we do in the home setting
And
as
I
well.
truly may just not have seen him pick it up off the little strip.
There is that.
He did.
Have you heard her say anything?
Okay. So this, like I said, pull back or you just push right up and then you can. That goes just like that. I could have sworn I did get an alcohol swab out. All right. So, let me bend down here.
Are you all right? You're working pretty hard there, Jenna.
That's okay. I got another 5 weeks or so of working hard, and then
Then you're going to relax for a while. Well, it's not such a relax.
Yeah,
Nothing.
not quite.
yeah, I know.
Congratulations.
Thank you. Yeah, it's been a
When is your due date?
I'm doing 5 weeks.
When is that?
It's like September 23rd.
September 23rd.
Yeah, or September 16th technically.
We'll be praying for you.
Yeah. Whew.
I have a granddaughter who's pregnant. Her date is until November the 7th.
My
So
daughter.
Oh,
she's a little
Is this
behind
your
you.
first or?
My first grandkid.
is your first grandkid?
Yeah.
Oh, that's
It
exciting.
is exciting.
Yeah.
Is it your first child?
This is my third boy actually.
My goodness.
Boy, my.
Yeah.
People right across the street have 3 little boys. It's fun to watch them run up and down.
Yeah.
From a distance, yeah.
Yeah.
from a distance.
Let me see. And I am just going to, this is not something that, interesting. Aha, there it is. Okay. So you do not have to do this when you flush this. I just did just so I can document it. You do have good blood return. So
That's good.
yes. So there's that.
Still have blood. That's excellent.
And
Nicely
then let me
done.
A little bit.
this. So there's your,
Kick line shower cover, waterproof. Is that what you ordered?
I think so.
Okay.
whoops, okay. I'll grab that. Push and twist. You got to push and twist. And then once that's on there good, you just unclamp. And see, like, look, you can see the difference between these two
yeah.
now. And you can actually see if you pull this out, this is how much more of the medication is left to be infused. When this is done,
The inside sleeve there.
yeah, you can see it's like a little white core, like literally. And then you'll know it's done.
Okay.
So, which is good. So we know that both of those are in there, infusing well. Okay.
You said it takes about 30 minutes?
Yes.
Okay, so we did that first one at 5:20. In another 10 minutes or so, we can tell if it's finished.
Yeah.
It's mostly done. Well, it's at least halfway done now.
Yeah, for sure.
Probably
Right.
3/4.
Core.
Not good at my attention to volume in a sphere. But
Okay, I'll not think about that.
conservation of volume. Excuse me, wrong phrase. Conservation of volume.
38 was the second one.
You having fun yet?
Yeah.
So I'm just going to prepare both of these ahead of time. And then,
Just put down on the little.
Yeah.
Once you run that little bubble out, then you put the top back on it?
yep, just make sure you don't touch like this little swirly part.
Yeah.
Because that's the part that goes in there.
And to him, yeah.
Yep, so you just touch this end cap and then just right here. Okay,
Only touch the end.
so let me see. We'll do this one first. Just literally. Okay. And actually, can you, I'm sorry, I know you're recording. Will you just grab me an alcohol swab out of there?
Oh, I can do that if you're.
Oh, sorry, yeah. Because my finger just touched it as
There
I
you go.
unhooked it. So, there you go.
Okay.
Good learning, good teaching moment.
But see, it teaches us what not to do.
There, yeah, exactly.
It's always important.
Perfect, thank you.
Scrub the hub.
Yes, exactly.
Rescrub the hub.
Yeah. Okay, and then the other thing, so when you go to do it daily, just you'll want to make sure too nothing funky is going on. There's not any kind of like excessive bleeding or anything like that up there. Basically, that the site doesn't look.
Just kind of look at it, and it should look the same every time you look at it.
Yep, essentially, yep.
Okay. And you just squeeze that in nice and slow.
Yep. Can you taste it or anything?
Mm.
No.
Just say salty, right?
Depending on how fast you push it, and I mean it's saline, so it's not like you could really, push it however fast you wanted, but sometimes you can taste it. These just peel right off.
Okay.
Okay. They just pop off.
So then this you'll unscrew, and then this you put on, and it just
Push and
screws.
turn?
Push and turn. Yep.
Okay.
This, when you push and turn and it gets on there tight, a little bit of the chlorhexidine.
Comes out on
I
the
think
back.
that's what's in there.
Okay.
Yeah,
Okay.
chlorhexidine comes out. So there's that. Let's
Yeah.
get this one. Okay. Push and twist. This red one, there is slightly more resistance, but still not.
And either one of them can be used for either one. It's not
Yes.
like we have to remember,
Right. Yep. So there's that. And then peel that off. Sorry, it might drip on you. I tried to catch most of it. Okay, so there's that. Let me this out of the
all
way.
done.
And does he need one of those little sleevey?
Yeah.
Cassie, you're very helpful.
I try to be.
Yep, you are. I like having you around.
Well, thank you.
FDR took documents home and didn't release them for 47 years.
Actually, you know what? I'm gonna stick this other one.
Obama took home 30 million pages.
Doesn't matter how long as it just covers the thing,
Yeah.
covers the
This-
port.
You want it so when you stretch this out, it's gonna get smaller.
Right.
The important thing is as long as it covers and keeps it kind of secure.
But he didn't need it.
We're ready to take this home.
All right.
Excuse me. you take a shower at the hospital at
I don't
all?
know.
Okay, what we might do,
I
if
got
you,
like bathing me.
what?
There you go.
They gave me a bath.
They bathed you?
Yes.
I was thinking if you get ready to take a shower before that thing comes in, and I'll wrap it in saran wrap for you.
Well, that thing will come in tomorrow. I don't think he'll need a
Yes,
shower
it will.
before tomorrow.
Yep, we won't do.
Looks good.
Oh, excuse me.